My name is Kausik. I'm Professor of Public Health, immediate past President of the European Atherosclerosis Society, and I was one of the coordinators for the EAS 2022 LPA consensus statement. So it's a great pleasure to be here.
Thank you, Kosh. And you've just finished day one. What were your impressions and your key takeaways so far?
Well, I mean, firstly, it's rare that you get a room full of the quality of people that were in the room yesterday, from every walk of academia, clinicians, patient advocacy, policymakers, and we have more of that to come today. And the key thing that we all agreed upon, which is great, is that LPA, or elevated LPA, an inherited genetic risk factor for cardiovascular disease, is something that is worthy of our time and our efforts in terms of screening, detection, management. And this really needs to be put on the agenda for every health ministry and every government around the world. And that's really the key take home of yesterday.
Thank you. And that's all going to be pulled together into the Brussels Declaration. How do you feel that can be specifically leveraged going forward within the UK?
Well, I think a declaration like that is critical, because it gives a it gives a framework around which we could say that these are very simple, common things that we can all agree upon. And we use that as a starting point for how we take that at every single country to try and implement those things. And so the Brussels Declaration essentially is that LPA testing should be available in every country in the world. It should be part of every country's cardiovascular prevention policy, and it's cost saving. I mean, we saw that yesterday. One of the key things yesterday with anything where we talk about identifying something that isn't routinely assessed or in a haphazard way, that actually if we did this, we can justify it because of the cost savings that would come from preserving health. And so that was a very, very important takeaway from yesterday.
Fantastic, thank you. And going forward into day two, we have the MEPs and the Polish presidency here as well. So hopefully we'll be able to encourage them to agree to the Brussels Declaration and then take that further afield and make it relevant at national country levels globally as well.
Yeah, I think if we can manage to do that today, that would be a huge plus. And sometimes we need more than one meeting, but the fact that they've agreed to attend is a really, really encouraging sign. And if we get that sort of sign off, then I think it's going to be a very exciting time for all of our patients that we can actually better help. I mean, those that we've already detected and are managing, and those yet to be detected. And I think that's really where today is so critical for the future.
Definitely. And just to finish, Kosh, yesterday you came up with that fantastic phrase of, well, say it in your own words. It was
there were a couple. There were a couple, but one of the things I was going to say is that I think I said that I just come from London to Brussels, and it was one small step for man. But when you actually look at the totality of the people in the room and what we were trying to achieve, it was one giant leap for LPA.